Okay, we'll keep going. My name's Tracy Maynard and I'm the Country SA Primary Health Network Nurse Consultant, and this presentation is really aiming to give you an overview of the work that we're doing within the SA Primary Health Network Immunisation Hub, the activities and some exciting innovative programs that we're running within this program, benefiting the community and also our immunisation service providers across South Australia. Just before I make a start, I'd also like to acknowledge my co-author, Angela Newbound, which I will introduce as we go along as the members of our team. So where does immunisation fit in the work of the primary health networks? The objective of the 31 national primary health networks across Australia is around increasing the efficiency and effectiveness of the medical services that we're offering to our patients, in particular those at poor risk of health outcomes, and also about improving coordination of care. So we're about ensuring patients receive the right care at the right time in the right place. So the Commonwealth has set 6 key priority areas for all of the primary health networks across Australia, and these priority areas include mental health, Aboriginal and Torres Strait Islander health, population health, health workforce, e-health and aged care. So as well as those 6 main key priority areas, we have what the government has also asked of us, which is to focus on 4 national performance indicators. So you can see there that improving childhood immunisation rates is one of those performance indicators. However, if we think about how we can prevent hospitalisations, there's also linkages there to vaccines, particularly in regards to preventable diseases such as influenza, pertussis, pneumonia, and some vaccines such as hepatitis B and HPV, which are reducing the likelihood of liver cancer, cervical cancer and other types of cancers as well. So historical immunisation issues have been the same, certainly in South Australia, whether you're living in country or metropolitan Adelaide, we've seen the same issues, and certainly I guess there's no difference in seeing those issues nationally either. We've seen timeliness of vaccination being issues, access to service, language barriers, cleanliness of the data that we're putting into the AIR, and also vaccine hesitancy for many parents still out there across Australia. So in South Australia, we believe the best approach to take was for the 2 primary health networks in South Australia, both Adelaide and Country PHN, to jointly implement an immunisation program that would ensure that we had a unified ongoing immunisation focus across South Australia. So the hub's really about supporting the community by promoting vaccine awareness and the need for a well immunised community, as well as increasing the accessibility of immunisation information and services. As well as the community, also providing support to our immunisation providers by bridging gaps in immunisation service provision and also supporting and upskilling immunisations providers. So improving vaccination coverage for all South Australians is an ultimate goal of our immunisation hub across South Australia. So these are the team members within our hub. Firstly, Angela Newbound from Adelaide Primary Health Network leads the immunisation hub as the Immunisation Hub Coordinator. For those of you who come from South Australia or have been in the immunisation world for some time would know Angela really well. She's been in this space for the last 20 odd years. So along with Angela, we have Alex Stevens, who's our Immunisation Hub Project Officer. So Alex's main role, as well as supporting some education and providers, is around looking at our data and really trying to drill down on areas of low coverage across our state. And my role as nurse consultant is around specifically supporting, providing education across to our country members as well. So it's a multifaceted approach or a collaborative concept that the SA PHN Hub is all about. And so we focus on 5 main areas or domains. So that's around looking at our immunisation data, the Champion Nurse Immunisation Program, which I'll talk more about shortly, service delivery, stakeholders and provider support. So some of these activities include, under those domains, around assessing and bridging identified gaps in immunisation service provision, for the provision of a suite of education sessions for new, particularly and experienced immunisation providers, the Champion Nurse Immunisation Program, so that's around providing direct support and mentoring for immunisation providers. The Immunisation Providers Network, I'll go into that in a little bit more detail, but that's also assisting providers with networking and providing advice and advocacy around issues that really affect them as immunisation providers and as a community as a whole, and in particular the Australian Immunisation Register data. So it's looking and reviewing that data, ensuring it's uploaded and supporting providers with the accurate record entry into the register. So the Immunisation Providers Network provides a forum for immunisation providers to interact with like-minded people, share ideas, discuss concerns and issues, and seek guidance and support and disseminate information. So membership to the Immunisation Providers Network comprises of any individual that might be associated with or involved in the delivery of immunisation programs in South Australia. And this includes, but is not limited to, GPs, nurses, midwives, Aboriginal health workers and pharmacists. There is no cost to be involved in the Immunisation Providers Network, and we currently boast over 350 members across South Australia. Some of the other support work that the Immunisation Hub does is that it provides the facilitating and secretariat support for this network. So we hold 3 Metropolitan Adelaide meetings a year with teleconference link up for country members, as well as having an all-day workshop around different areas of the country annually as well. So the provider education, the Hub provides regular professional development opportunities for immunisation providers, including GPs, nurses, Aboriginal health workers, pharmacists. So the suite of education includes immunisation updates. So these are around, usually updates that typically cover the incidence of disease, pathophysiology, complications, and specific schedule changes. So last year we had around 474 attendees to education sessions that we focused on influenza, meningococcal and travel medicine updates, and we had a satisfaction rate as 94% as excellent or good, so that was really well received. The other thing that we target our education to is an introduction to immunisation, and this is really, really important. We see that there's particularly particularly in the metropolitan area, a number of new nurses coming into general practice, or who certainly don't have any little understanding of the immunisation provision and programs. So this workshop certainly targets that. So they cover topics such as basic immunology, communication, vaccine and cold chain management, vaccine administration procedures and adverse events. So we had 75 attendees last year with those particular programs run throughout the year, and we had 94% attendees saying that it was their satisfaction was excellent or good, which is again really fantastic. The Champion Nurse Immunisation Program, so within the Hub we also offer this program. This is a program that is commissioned through the Adelaide Primary Health Network, and they've commissioned an organisation called the Health and Immunisation Management Services. So the Champion Nurse Immunisation Program uses specialist nurses through HAIMS to provide immunisation program support to providers in the wider community. So being 3 members of the team across South Australia, we really wanted to get out on the ground to be able to provide direct support to immunisation providers on the ground. So this is what this program offers. So HAIMS is a nurse-led organisation with experience in delivering immunisation programs and education, supporting providers and communities and working with vulnerable populations. So the Champion nurses are focused on helping to increase vaccine uptake, as well as augmenting provider confidence and knowledge pertaining to immunisation delivery. So the sorts of things that they undertake with their activities are around delivery of immunisation program support, so that's direct mentoring, one-on-one, and particular mentoring with those immunisation nurses that might be new, or pharmacists, to immunisation program delivery. It's around delivering education and support regarding cold chain management, and also providing support in regard to documentation, so recall and reminders and things like that. Immunisation register support and education, and most importantly, providing direct information down into our communities. So whether that be support for families with identified barriers to vaccine update, or that may be through vaccine hesitancy and having counselling sessions with parents as a whole. Some of the other activities that the Champion Nurses undertake is around providing support to CALD families. And so this is including Adelaide University international students and their families. So the sorts of activities they undertake with this program is checking whether the child is up to date according to the Australian Immunisation Register, supporting catch-up vaccinations, linking them with other doctors or certainly other immunisation providers to ensure that they are immunised according to the register, and also providing further support in regards to vaccine concerns or any hesitancy. Other activities include the development recently of a vaccine hesitant resource folder that they use not only to support the vaccine hesitancy or concerns, but also to use that with mentoring for other immunisation providers. They do things like looking at specific overdue postcode, low specific postcode data, so they'll directly call, and also they attend community events, example like Closing the Gap, and target childcare education as well. So that just gives you a brief overview of the activities that we provide within the hub. These are our contacts, certainly for Angela, Alex and myself. So if there are any further questions or would like to make contact, you're more than welcome. Thank you.